and I'm so happy to welcome Dr. Shashikala, Chairperson, Director of Medical Electronics, Dr. T. Jayashree, Treasurer, Associate Professor, Department of ECE, Dr. P. Murali, Mr. Sivanyanam Subbaya of Appaswamy Associates, student leaders like Kirtana, Aisha, Janani, Siddharth, and Vishal, who came to my hospital and persuaded me that this is a worthy cause. Hande Hospital is very proud to be associated with the Biomedical Engineering Association, College of Engineering, Guindy, India's oldest technical institute and the flagship campus of Anna University. I know that you conduct these events regularly, yearly, for more than a decade, am I right?
Yes, sir.
So apart from MedEvolve, career guidance programs, alumni meet, special classes and support sessions for junior students, by senior students, your flagship event is today's Biospectra event, which is a prestigious national intercollegiate technical symposium. So you have various project expos, paper presentation, and so many people, I think I see them, some people exhibiting their EEG, 3D, cataract, phaco emulsification surgery, and some novel innovative sanitary pads. So this is a sort of a conference, a Biospectra extravagance of bioengineering sort of symposia. I'm glad to be part of it. So Aisha told me that last time somebody came and addressed us and gave us some sort of interesting insight into some of the things you went through in your training career. So after I completed my MS, as the person who introduced me, I wanted to get a degree from a foreign country, and so those days all of us would go to the Royal College of Surgeons in Edinburgh. So it's quite a tough exam, and you have 6 plus 6 plus 6, 18 examiners to examine you. So during the Viva, that is the question and answer section, so the person asked me, how does the flexible endoscope work? So I was racking my brain, and I was talking about the angle of incidence of the light, angle of refraction, critical angle, total internal reflection, and how the endoscope has got coated glass fibers, and so even if it is flexible, we can project the image from one end to the other. So at that time he asked me, at that particular point of time, about 5-6 years since the flexible endoscope came to being, and also that was a time when HIV was raging. So he asked me if you do an endoscope on a patient in India, and you remove your endoscope, and you find nothing wrong, but you have a diagnosis that the patient has HIV, what will you do with the endoscope? That's the question. So I said, I don't know. So then he said, draw the virus, the cell wall of the virus of the HIV virus. So I drew it, and I showed him some fat lobules in the cell wall of the HIV virus. So then he asked me, how do you get rid of fat? So I said, with soap. So then he said, I can use Savon to clean the endoscope and reuse it again. So that was a learning. So there I realized these exams are not meant to test what you don't know, but they are meant to test what you actually know. So that was a revelation to me. And then I came back and did my MCH in plastic surgery. Here I want to sort of, there are two quirks. See, nature is not like biomedical engineering. Still, there is a lot of things which we don't know. Why do we age? Why does one get old? Why does one get white hair? Why do males predominantly get bald? So when I was doing that research, because we do hair transplantation, it's very interesting that the testosterone hormone in the male is the cause for male pattern baldness. So somehow the hair in the center of the head is programmed genetically to switch off at a particular age, maybe 30, 25, 30, because of hereditary reasons. Somehow the hair at the back, if you see bald people, they will have hair at the back. So if you see that hair at the back is not sensitive to testosterone. So if I physically transplant that hair at the back to the area where the hair follicles are sleeping because of testosterone, that insensitivity to testosterone is still retained and that hair gets its blood supply and grows. So this is the principle of hair transplantation which we do quite often. The other quirk of nature is, if you see, take a lizard and you cut its tail, the tail grows back. Genetically, the only organ in the human being which has the propensity to regrow is the liver. You can donate a kidney, it's a paired organ. A father or a mother or a child can donate to the other person. But a liver is a single organ. So though the patient has cirrhosis and the liver is not working, if you take a small portion of the liver from a donor, after removing the diseased liver, the liver grows back to its normal size like the lizard's tail. And the patient who has donated the liver, her liver also grows back to its normal size, though she has donated part of the liver. So these are sort of interesting facets of medicine which still are mysteries to us. So as students of biomedical engineering, all of you are sort of in the cusp of an explosion of knowledge. Normally, the knowledge can be incremental increase. Incrementally, it can grow. But you are in a cusp where there is going to be a quantum growth of information, so much so that you are in the right place at the right time and doing a fabulous course, and the sky and the world is open to you. If biomedical engineers were not there, we doctors will be still in the dark ages. We will be probably using a stethoscope, the old method of palpation and percussion to find out diseases. So one of the things which you have given us is the telescope, the rigid telescope which has glass rods inside and the spaces in between acts as a lens. So in laparoscopic surgery, we introduce the telescope through the umbilicus, distend the abdomen with carbon dioxide, fit a camera to the telescope and see what is inside, and we can do various surgeries. We can do gallbladder surgery, we can do appendicectomy, we can do hernia operations, we can do episiolysis where the intestines are stuck to each other. So this endoscopy and keyhole surgery further expanded, and we could put it inside a joint space, create a space and do, say, a meniscal repair in the knee. Or we could introduce it through the nose, through the sphenoid bone, and go and operate in the pituitary, which is known as a basal skull surgery, which all is being done in Hande Hospital. Urology, we can do transurethral resection of the prostate. In gynecology, we can do a hysterectomy without giving a long scar. So all these advantages have accrued due to discovery of biomedical engineers. And the other new thing which you have to be sort of using extensively is laser surgery, where we do piles operation, we do varicose vein surgery, we do liposuction, we introduce the laser under the skin, loosen the fat and suck out the fat, and we can do laser surgery. Laser liposuction. It is ideal for localized collection of fat. It's not a substitute for dieting or exercise. So biomedical engineers are innovators of modern medicine. They harness the power of technology and save lives. They are the bridge between, as Dr. Shashikala said, they are a bridge between medicine and engineering. We would love to collaborate in any way, because I see your syllabus is an extensive, quite a frightening syllabus. Engineering and mathematics, electrics and electronics engineering, anatomy, physiology, digital imaging, radiological equipment, hospital management, medical ethics, and various laboratory courses. So, also because biomedical engineers are involved, you assure the safety of the machines that we use and see to it that it is absolutely safe because you validate and put it through stringent processes. And because of biomedical engineers, you have democratized equipment, medical care, because the same thing can be used extensively even to the poorest of the poor in the remote village. So that is what biomedical engineers have done. And I am very happy that this year's theme is Biospectra'24 is artificial intelligence, and it has been integrated into biomedical engineering. So they analyze medical data, predict patient outcomes, and optimize treatment. The synergy between AI and biomedical engineering holds immense promise. Even today, when we take the ECG in Hande Hospital, the ECG comes out, on the top it's written there, right bundle branch block, heart rate, left axis deviation, inferior septal infarct. So at once the nurse is alerted, she takes a picture of it, sends it to the cardiologist, and then he says what the treatment is. So of course WhatsApp has helped a lot in this human fractures. We send it to the operative surgeon, immediately he tells us what is to be done, and he picks up the date and quickly operate on the patient, because old patients cannot bear bed rest for long. I mean, for 5-6 days they are in bed rest, they will perish. Same way for an X-ray. It's a very simple thing. But an X-ray is seen by a pulmonologist who sees the lungs, is seen by an orthopedic surgeon who sees the ribs, scapula and clavicle, is seen by the spine surgeon to see the spine. So many is seen by the cardiologist to see whether the heart is enlarged, whether there is left ventricular hypertrophy because of long-term hypertension. So all these people have put their expertise and find out they are all working in silos. A radiographer interprets, but they have found with artificial intelligence, 98.1% of the time the computer, the artificial intelligence can recognize what is wrong with an ordinary X-ray, whereas only 78.1% of times the radiologist can discover what is wrong with a common X-ray. So there itself you have an example of artificial intelligence. Just imagine, if in a remote village somebody takes an X-ray, he immediately knows that the patient has got tuberculosis, he can follow up with medicines, and it democratizes the healthcare system by giving it in a large country like us to remote places. So that's the beauty of AI. In fact, after that, even interpretation of CT scans, magnetic resonance imaging, or positron emitting tomographic scans can all be done by artificial intelligence. In fact, recently, if you see, Mr. Sundar Pichai of Google said he's done some work with the Arvind Eye Hospital, which Sinyan is associated with. They did a retinal scan of 285,000 patients. So they found out the caliber of the retinal vessel, so with that they can predict what major cardiovascular catastrophe or event is going to happen in the next few months. So just a retinal scan as a patient comes in is not yet coming to the market, but Google is AI is especially the MedPalm 2 is trying to find out ways in which they can predict the cardiac event before it occurs through a retinal scan. So these are all spheres where explosions of knowledge are taking place, and I am so happy that all of you are in this space. So can all of you see our country is expanding,